So fat grafting to breast, it has gained popularity in the cosmetic surgery due to its natural result and the dual benefits. So natural results mean we are using your own fat, so we are not putting anything artificial. And dual benefits means we are increasing the size of the breast and we are also doing the body contouring. From where we harvest the fat, you get a very good shape from the abdomen or from the thigh. So uses of fat grafting in breast surgery. So first is the cosmetic breast augmentation. So it enhances the breast size and the shape using your own fat. So it is ideal for those who want a modest increase in the breast size, that is typically half to 1 cup size. So it is suitable for patients who wish to avoid the implants. Second use of fat grafting is in the breast reconstruction. So commonly after the breast cancer surgery called the mastectomy, so we can improve the contour, fill the defects and refine the reconstruction. And third is correcting the breast asymmetry or any deformities. So if there is unevenness or irregularities due to genetics or due to trauma or prior surgery, we can improve the breast symmetry with the fat grafting. And last is the post implant refinements. So many patients who has undergone the breast implant surgery, so fat grafting is used to camouflage the visible implant edges or the rippling. So and it adds volume also to the area where the patient don't achieve the desired contour after the breast implant. So what is step by step process of the fat grafting to the breast? So first is the preoperative planning. The surgeon evaluates your overall health and checks the fat deposit, from where to harvest the fat and the desired outcome. The imaging, we can show you certain 3D simulations to visualize the expected results. And last is the discussion of the expectation. We can show you some before and after pictures to understand your mind. And we have to tell you the possibility of the multiple sessions, because in fat grafting there is some absorption, we might require 2 sessions. Second is the procedure itself. In procedure itself, we do the fat harvesting first by liposuction. The surgeon performs the liposuction under anesthesia to remove the fat. So common donor sites include the abdomen, the thighs, the flanks or love handles, the buttocks. A cannula is used to suck the fat gently, preserving the integrity of the fat. Second step is the fat processing. The harvested fat is processed by special techniques such as centrifugation, the filtration, the washing. So this separates the viable fat cells from the non-viable cells such as oil, RBCs or other fluid which is discarded. And last technique is the fat injection. So this purified fat is injected into the breast in very small amounts using a thin cannulas, and injection is made very carefully layer by layer, achieving a smooth and the natural result. The surgeon strategically places fat to enhance the volume, the shape, and to achieve symmetry on both sides. So, what are the benefits of the fat grafting? So, first benefit is the natural looking result. So, breast feels soft and look more natural as compared to implants. Second is the minimal scarring. So there are very small cut on the side or under surface of the breast which are hardly visible, and again a very small cuts for the liposuction. So they are just half centimeter of the cuts and there is a minimal scarring. Third benefit is the body contouring. So liposuction from the donor side, it improves your overall body shape and the low risk of the complication. It eliminates risks associated with the implants, such as the rupture of the implant, the capsular contraction, the displacement of the implant. So all these risks are not possible with the fat injection. Last is it is a customizable procedure, so it allows the precise correction in the contour and symmetry and the volume on both sides. So, what are the potential complications or the risks? So, yes, it has got some potential complications, though they are very rare if your plastic surgeon is trained and doing such procedures over many years. So, first risk is the fat absorption. Up to 30 to 50% of the transferred fat may be reabsorbed by the body. So, this can lead to volume loss and may require additional session of fat grafting for the optimal results. Second is the fat necrosis. So the fat may die inside your breast, leading to oil cyst formation. So some fat cells may die, forming a small lump or the cyst in the breast. This can usually be distinguished from the cancerous lumps during the imaging. So you get some imaging done, you can find that there is some fat necrosis. Oil cyst. So fat, it may break down, producing the oily fluid filled cyst, which may need drainage at a later date. And calcification. So calcification of the fat is possible, and it mimics the suspicious finding on the mammogram. But with the modern imaging techniques, we can usually differentiate between these two. Other risk can be from the infections, so there might be chances of infection, the bruising or swelling. So as with any surgical procedure, there is a small risk of these side effects, but these are rarely threatening. So what are the limitations? So volume achieved. Fat grafting is best for the subtle size increases up to half to 1 cup size per session. For significant enlargement, breast implantment is more suitable. Second limitation is the donor fat requirement. The patient needs adequate fat deposits in other parts of the body for the donor sites. Thin individuals with the low body fat may not be a good candidate for the fat grafting. Durability of the results. So fat grafting results are permanent for the surviving of the fat cells, but weight fluctuations and aging may affect the breast appearance over the time. So multiple sessions. Achieving larger volumes or correcting significant defects may require multiple procedures of fat grafting. Smoking and healing. Yes, smoking impairs the fat survival and healing. Smokers are usually advised to quit smoking around 1 month before and after the procedure. So recovery process. So immediate post-operative period. So there will be swelling, bruising or mild discomfort at the site of liposuction and the fat grafting. Patient usually return to light activities within 1 week. So compression garment is worn over the donor side, over the liposuction sites. So fat survival. The injected fat establishes the blood supply in the recipient area or the breast over several weeks. So you should avoid pressure or trauma to the breast during this period around 4 to 6 weeks to improve the fat survival. Final results is visible around 3 months when the swelling resolves and the fat stabilizes, and we take the before and after pictures. So who is a good candidate? So your desire for the natural breast augmentation, you desire for the realistic expectations, you have enough donor fat available, and you are in a overall good health, and you are a non-smoker. So then you are an ideal candidate for the fat grafting. So what are the alternatives? If you don't want fat grafting, I might advise you for the breast implants. So breast implants are ideal for the patients who seek for the significant size increase, and they are often offer predictable result, but it involves the foreign material. So there are benefits and the disadvantages also, but the results are more predictable and to a larger extent by the breast implants. And we can do breast augmentation using a composite method, that we can put the implant also to camouflage the implant. We can do the fat grafting to refine the contour. So we can do combination of the both procedures. So fat grafting is an advanced procedure required requiring a skilled plastic surgeon and expertise who's expert in both liposuction and in the fat grafting for the breast enhancement techniques. So proper planning and realistic expectations are essential to achieve the optimal results.